What's up, everybody? In the last few lessons, we've been talking about vocal health, and today we're talking about lifestyle. We've talked a lot about how the body is our instrument. We hold a trumpet or a guitar or any other instrument usually, but for singers, we live inside of our instrument, and so the way that we treat it matters, and that includes the way that we go about living our lives. The first thing is we should really be getting 7 to 8 to 9 hours of sleep a night. The body needs this in order to rejuvenate, and I'm sure most of you have noticed that when you're well rested, you tend to sing better and just have more energy in general. Many people say, I don't have time to get that amount of sleep, and I sympathize with you. But I've heard a number of professional singers say that while they'll compromise on certain things, they will make sure to always get 7 to sometimes even 10 hours of sleep a night. And that is one thing that they won't budge on. So sometimes we have to sacrifice other things in our life in order to prioritize getting this amount of sleep. But the fact is, it really does make a difference. In this same vein, we also want to make sure that we're eating right and also exercising, right? We want to keep our body in good condition, and all of these factors go into our overall health. But the quality of our health also affects the quality of our instrument. So all of these holistic lifestyle factors are really important to keep in mind. We've talked a lot about hydration and the different drinks that you can or maybe shouldn't drink before singing, but when it comes to food, things that you probably want to avoid are anything too spicy, super fried, or very sugary. Pretty much anything that has a likelihood of causing acid reflux. We'll talk more about that in another video and certain vocal conditions that can develop. But in general, if you can avoid these foods before singing, it's probably going to give you a better likelihood of being in good vocal condition. As always, different foods and drinks affect people in different ways. So if these things don't bother you, awesome. It's just something to keep in mind when you're preparing to sing. I want to talk a little bit about medications. We talked a little bit about allergies in a previous video, but when it comes to allergy medication, it's important to know that most allergy medications are pretty drying for the body. So if you do need to take a common over-the-counter allergy medication, just check if there's a dryness side effect on the back of the carton or the bottle. And if there is, you can either try to switch to a less drying medication, or you may just have to overcompensate with water in order to get the hydration level that you need. A good recommendation is to actually take the medication at night if that's possible, because that's when it's going to have the least impact on your voice. I also want to talk about a number of really common over-the-counter painkillers that fall into a category called NSAIDs. NSAID stands for non-steroidal anti-inflammatory drugs. Types of NSAIDs are ibuprofen, Advil, Motrin, aspirin, naproxen, and Aleve. The way that NSAIDs work is they block two enzymes that cause inflammation, pain, and fever. But one of those two enzymes also has to do with the ability of the blood to clot. Now, if you get injured, say you stub your toe, and you take an ibuprofen or an Aleve, your body doesn't know to just direct that medication to your toe. It affects your entire body, reducing inflammation and pain, but you feel the effects in your toe most prominently because that's what hurts. Under most circumstances, this is not a problem. However, there are times where this can be somewhat dangerous for singers. We've talked a lot about the vocal folds and how they're kind of like two elastic bands that sit right next to each other and they open and close. Well, some people have a blood vessel that sits right on the edge of their vocal fold. Sometimes it's possible to tell if a singer has it using a scope where you can peer down the throat and look at the vocal folds, but sometimes that blood vessel can be out of view. So it's really actually quite difficult to know if a person has them. And so what happens is when a person takes Aleve or any other type of NSAID, it increases the risk of bleeding because remember that it blocks the ability of that one enzyme to help with blood clotting. And so if a singer on a given day is using a lot of vocal output, what that does is increases the risk of that blood vessel bursting and actually producing a vocal hemorrhage. Now, this is really particularly important for women on the first and second day of their menstrual cycle. The vocal folds are actually already just a little bit swollen naturally on these days. And so if a person is in that condition where they've got a little bit of swelling in the vocal folds, they are using a lot of vocal output and they've got that blood vessel right on the edge of their vocal folds, which again, it's really difficult to know. Taking an NSAID is going to increase that risk of vocal hemorrhage. So a good guideline from most vocal scientists is going to be to take Tylenol. The reason is that Tylenol works a completely different way and actually deals with pain receptors in the brain, as opposed to dealing with the enzymes that are partially involved with blood clotting. People always get super freaked out about this when I talk about it, and people are like, I never want to take Advil or ibuprofen again. Don't panic. Again, it's just in these really specific circumstances. So for me, I will usually determine whether or not I'll take an NSAID based on whether I have a lot of vocal output that day. If I'm just at home and not doing very much that day, I will take an NSAID and not have a problem with it. But if I know that I need to perform that day, or I have to record something, or I know that I'll have heavy vocal production, then I'm probably going to try to stay away from an ibuprofen, maybe take a Tylenol, or see if I cannot take anything at all. So armed with this knowledge, hopefully you feel more equipped to make lifestyle decisions that are going to be not only beneficial to your body, but to your voice as well. Until next time, see you later.